Well, welcome back, everyone. You know, October is Breast Cancer Awareness Month. And Dr. Darlene Weyer, director of the Lima Memorial Women's Health Center, is here to talk about screenings. So, doctor, welcome, first of all.
Thank you, Chris. Thank you for having me.
My pleasure. All right, now, why is it important to have an annual mammogram screening?
It's very important to have an annual screening mammogram because if you have your mammogram today and then you wait 2, 3, 4, 5 years to come back for your next mammogram and your cancer starts tomorrow, the day after you had your mammogram, that cancer has time to grow and potentially spread through the body. So we follow the recommendations and we tell all patients to have a screening mammogram starting at the age of 40 and have it every single year. Don't ever skip.
Right. Now, who is actually a candidate or recommended to start receiving mammograms? And then also, what can they expect when they come for their screening?
Yes, we start screening mammograms at the age of 40, unless they have a first-degree relative, meaning like a sister or a mother who has had breast cancer. And then if that person in their family had breast cancer, we start 10 years prior to that having screening mammograms. So if your mother was diagnosed with breast cancer at age 42, you would start your annual screening mammograms at age 32. But if you have no sister or mother with breast cancer, you should have a mammogram starting at the age of 40 and having one every single year. And what you can expect is it's a quick exam. It only takes about 15 minutes. It's a 15-minute exam that can potentially save your life. There is no pain. You hear stories about the breast being placed in compression, but the breast is, that compression device comes down very slowly and very softly, and you're not in compression, but just a few seconds for each image. We take 2 pictures minimum of each breast, and then you're free to go. It's a really quick exam.
Yeah, I was going to say 15 minutes, easy peasy, lemon squeezy. Now, between yearly mammograms, what can a person do to help protect themselves against breast cancer?
Things that they can do is do a monthly self-breast exam because typically a woman will find a lesion before anybody else will find it. So that is very important. Eating healthy, getting plenty of rest, plenty of exercise, don't smoke, limit your alcohol intake, decrease your stress levels. The best way to decrease your stress levels is to live in the moment and stop worrying about what happened in the past and reliving the past. And stop worrying about the future because those are things we cannot control. By decreasing our cortisol levels, which is a stress hormone released by the adrenal gland, that way you'll have less inflammation throughout the body. Studies have now shown that inflammation leads to most chronic disease processes and most cancers. So I tell patients to try to just stay in the moment and also eat healthy, limit our sugar intake, limit your gluten because those things cause inflammation throughout the entire body, again, leading to cancers and chronic disease processes. And just getting plenty of rest and taking time for yourself, doing things that make you happy, giving back, contributing, things like that, that make you feel fulfilled. All that positive energy filtrates through your body and decreases your chances of cancer.
Yeah, such great information. Yeah, doctor, you're a wealth of knowledge. Now, if a patient would actually like to schedule a mammogram, how can they get in contact with you?
They can call 419-998-4497, choose option 1, and they can schedule their mammogram either at the Women's Health Center or our Wapakoneta Medical Center. By just calling that one number, we can get you scheduled at either place. You do not need a physician's order. So if you have not had a mammogram in the last year and you're 40 or older, please call our center.
Yeah, please do because, just 15 minutes really is important to your health. Well, Dr. Darlene Weyer, I really appreciate you coming out today, sharing your knowledge with all of our viewers.
Thank you for having me, Chris. I appreciate it.
Yeah, my pleasure. Well, don't go away because we have more when we return.